Cardiac conditions, from coronary artery disease to heart valve disorders, have long been some of the most challenging health issues faced globally. Traditionally, treating these conditions often meant undergoing complex surgeries with longer recovery times and greater risks. In the past, open heart surgery was the primary approach, but the landscape of cardiac care has now transformed dramatically with advancements in medical technology. Let's witness a revolution in this field with the rise of minimally invasive procedures.
I think everybody has realized that also both doctors and patient, no patient wants to have a big cut, and everybody has an illness, they want to recover as fast as possible with minimum pain, discomfort and go back to normal life. So slowly entire treatment over last 1 or 2 decades has evolving into minimally invasive or less invasive, and I very strongly believe that's the right way to do. And I see next 2 to 3 decades, measure of the treatment, today we are doing with a cut etc. will slowly go away and will be replaced with as minimally invasive surgery. That is where your minimally invasive surgery and robotic surgery etc. will play a very, very big role. Of course, it needs a lot of technological refinement, but the way especially technology improving, it is going to happen. So related to that, the cardiology practice, especially angiography, angioplasty, interventional cardiology has progressed significantly, especially last 5 to 7, 10 years. Mainly one is your treatment of blockages. Now more complex blockages can be done because the technology has changed, the tools, the instruments available to do it is improving. The second, especially with, it is still in the experimental stage, but I see next few years additional AI is going to help, because what it will do is we will be getting smart catheters, AI guided catheters. We don't need to do a lot of radiation fluoroscopy, because when you do angiogram or angioplasty, the cardiologists constantly look at the heart. To do that, they do fluoroscopy. Fluoroscopy has a lot of radiation to the patient as well as to the doctor. So the especially AI enabled the smart technology is coming, which is going to guide the catheter from the previous images the patient has from a CT scan or MRI or earlier angiogram patient has. You can do, the catheter can go to the coronary artery without doing a fluoroscopy. So these are the technologies coming in, which is going to be less invasive to the patient, less radiation to the patient. Similarly, the newer technology that has come in is the drug-eluting stents, medicated stent, what is called the medicated stents. Also the newer stents are coming in which will be absorbable. In the past it had come, but it was not very effective. But newer stents are coming in which are absorbable. So these are going to have a good benefit to the patient. One is the medicated stent that has come out, and more important also has come out in the terms of while doing it, the equipment that is coming to help. When I said the AI enabled smart catheters are coming in, which will be automatically guide the catheter, you don't need to do a fluoroscopy, it will go near the artery and do that. And then other technologies are available to help you. It's called fractional flow reserve, which accurately determines how critical is the blockage. Because as I said earlier, if the blockage is less than 70%, you don't need angioplasty or surgery, any treatment. It can be managed with medicine. Sometimes you do not know whether it's 70% or 80% or 60%. So there are technology to find out. One is called fractional flow reserve. Similarly, intravascular ultrasound, that will go more accurately the type of blockage is there, to so that the cardiologist can take an accurate decision what type of stent and size of stents, whether you need to do, what length you want to put. So these are the technology that has come in that helps. Because of that, the results of angioplasty has improved significantly in last 1 decade.